Hello everyone, this lecture will serve as a preparation for Dr. Freshour's inhaler activity, and Dr. Freshour and I designed this activity together to try and familiarize you all for some resources that exist for our underserved patient populations. I know whenever I went through pharmacy school in our therapeutic modules, we would design patient regimens for our cases a lot of the time with all these brand name medications, not really thinking about the cost of medications, but just thinking about therapeutic effect and trying to use medications that maybe had desirable side effects for patients. And a lot of time left out the really important consideration of, does my patient have insurance? How much money realistically can they afford, or how much money are they willing to pay for medications each month? And so hopefully this will help you to think a little bit about that as you start to go through all of your modules and start to get out on your IPPEs and APPEs and just create some familiarity with resources that we've had to learn along the way in practice. So objectives for today's lecture are to discuss underserved patients' ability to access and afford medications, identify resources to access prescription and non-prescription medications for underserved populations, and then to develop some thought processes for constructing medication regimens based off patient disease states and financial barriers that they may have. So this all sort of ties in to the worksheet that's posted onto D2L, and each of your groups has an inhaler that you're assigned to research and try and figure out what are some access points for patients who may not have adequate financial resources to afford medication therapy. So first I wanted to start with just a little bit of a background of medication affordability. So how affordable are prescription medications for our underserved patient populations? In general, prices for patented drugs, so that includes both brand and generic medications, are 50 to 100% higher in the United States than other developed countries. For example, we're about 50 to 60% higher than France for our medication cost, and then we're actually double the cost of medications compared to the United Kingdom and compared to Australia as well. And a lot of that is tied to the way that our health system is structured and who gets to set medication cost here in the United States. So in a lot of our European countries, they obviously have socialized medicine, so the government is sort of the only buyer that they have, and that creates a lot more buying power and buying strength, obviously, because you have one buyer versus hundreds and thousands of buyers. And then even some nations that don't necessarily have socialized medicine, they've created their medication pricing system so that the government has a lot more power to set prices and stating that they'll only reimburse to the therapeutic effect. So some countries, a government will only pay a copayment or a cost amount that drug manufacturer sets if they feel that the therapeutic benefit of that medication is worth it. Financial burdens for our households has decreased overall, so our economy is doing a little bit better. However, many Americans do not take their medications due to high costs. So people are really struggling to afford their medications, even though we're starting to have more financial income and people are starting to get raises versus staying same or losing their jobs as they were. Something that was alarming to me is 1 in 5 adults in the United States did not fill their medication due to cost in 2013. So that's huge and is something to really consider when you're dispensing prescriptions to patients or maybe working in a clinic, is asking them if they can afford their medications and also asking them what's reasonable for them. So are they able and willing to spend $20 to $100 on copayments for a drug, or are they only willing to set aside $15 a month? So just asking patients, and even for some patients, getting just the initial sticker cost of a inhaler copayment, so $35, is something that's hard to swallow for them. So making sure that they know that up front and trying to have a discussion of therapeutic benefit and seeing if the patient might be a little bit more agreeable to that. So the first resource that we're going to talk about is Needy Meds, and this is an online program that offers a generic assistance program. So they do not cover prescription medications. They only cover generic medications, but they cover generics that are generally a little bit more expensive. So generic medications that have maybe been subject to some of our price spikes that we've seen lately and historically are just not dirt cheap, like lisinopril and some of our other medications that you're going to find on a $4 list. This is offered in conjunction with RX Outreach, which is a mail order pharmacy that is only for this program. It's only for underserved patient populations. And they provide a voucher for patients to receive a medication at no charge for 1 year. The caveat to this is they limit each patient to only one request or one prescription. So they can't cover a patient's entire regimen just because of their limited sort of financial resources. But again, it is at no charge for patients for 1 year. And then if the patient is still on that medication and still needs to have it provided by Needy Meds, they can reapply after a year. So I wanted to highlight where to go on their website. So it's needymeds.org. And then if you go on the top banner and click on services, that's where you'll find the application. And it's the fourth one down to the generic assistance program. And you'll click on that. And this is one that the patient will actually fill out themselves. So patient assistance programs from drug manufacturers, a healthcare provider needs to fill out. And it needs to have a signed prescription from the nurse practitioner or physician providing care for them. For Needy Meds, for their generic assistance program, the patient will download the application and will complete it themselves. They provide contact information for their physician, but they should not send the original prescription. Qualifications for this is the patient must have no prescription coverage for their needed medication. So they either need to not have any form of prescription insurance, the medication that was written for their insurance does not cover, and then they don't have it listed here, but they actually on the application state that if the patient cannot afford the copayment, and they define that as $25 or higher, the patient can apply for the coverage as well. The second qualification is the patient has to be at or below 200% of the federal poverty level, and that is set each year by the U.S. government and can be found in the Federal Register. And that current amount for 2015 is provided as an additional resource on the D2L site. And then for this program, the patient must be a U.S. citizen or must legally be in the United States. So they have to have a work visa or a green card or something like that. So legal immigrants are not eligible for this resource, unfortunately. They did have a halt in services. So during the summer, they were not taking new patients. So that's something to keep in mind and to make sure you look up before you ever recommend this resource to patients, is they have such limited resources that sometimes they can no longer accept new patients, which is unfortunate. When patients are filling out the paperwork, it's really important that they only check one medication that they're trying to get coverage, because if they check more than one, the patient's going to have to be contacted for which medication is of greatest need or is of most sort of challenge for them to afford, and it will cause delay in their application processing. So keep in mind, again, it only covers one medication for a patient. However, they can get more than one if they pay the copayment amount that's listed next to the medication on the application form. So for example, they offer olanzapine 5 milligrams. It's an estimated cash price of up to $300 for a 1 month supply. Another resource that we'll talk about, GoodRx, it's actually $15, but patients can get it for $25 through this program. And then here, just for reference for you, is a list of medications that are currently covered by the assistance program. So unfortunately, none of our inhalers, but just an important resource for you to keep in mind. The next resource that we'll talk about is the Tennessee Drug Card. This is offered to all Tennesseans, as you can see here, and is marketed as a prescription assistance program. And that's a little bit misleading because it's not provided directly by a drug manufacturer or prescription wholesaler or anything like that. It's simply sort of a negotiation that has occurred between the state of Tennessee and about 68,000 different pharmacies, including chains as well, to offer a discounted price. So patients can save up to 60 or up to 75%. And it is offered to all patient populations. So I made a card here for myself just so you can see what it looks like. But patients go to the website, they simply enter their name, and then it'll generate this card for them to print off. that they then hand to the pharmacy technician when they're filling a prescription at their pharmacy. Eligibility for this one is a little bit different, so it's an opportunity for all patient populations. So even someone like myself who has private insurance technically can use the Tennessee drug card. It's also free and can be used as a supplemental program for most insurance plans. So with health savings accounts or maybe people who have high deductible plans. It can also be used for non-covered medications under Medicare Part D. There's no restrictions, so there's no enrollment criteria, no waiting period or eligibility criteria that has to be met, no waiting time, and no forms that have to be filled out at all, other than simply just your name to generate your card. Essentially what it does is it just gives you the best cash price eligible. And so as you can see here, there's 3 different ways that pharmacy is going to decide to reimburse or to lower your drug cost. One being the average wholesale price minus a certain discount level. The next being a maximum allowable cost, and so that's the number that our insurance agents or insurance companies such as CVS Caremark or Express Scripts will determine as the maximum cost that they'll pay for a prescription when a pharmacy sends a claim, or they'll reimburse at the pharmacy usual and customary, and so that's just cash price. And that can also be sort of related to or used or referred to as retail price, cash price, or promotional price. When pharmacies send this card through the switch and try and adjudicate a claim for this, there's no reimbursement that's coming to the pharmacy from any type of a PBM or any type of an agency. The pharmacy is just agreeing to accepting a lower cash price than they would otherwise. It includes both brand and generic medications, and then the card's pre-activated and accepted at most pharmacies. So once the patient prints that card out, it's good to be used. And then there's a list of pharmacies that are available, again, on the D2L site for you. But a lot of our independents are on there, so Mooney's Pharmacy, Westtown Pharmacy, and then a lot of our our grocery chains, and then our retail chains as well. So Food City, Kroger, CVS, Walgreens. So almost every pharmacy is on here. Again, if you just have a patient who has some difficulty affording their medication, if they mention that to the pharmacy, usually they're going to get the same price because all this card is doing is giving the patient the best cash price. If you also go to their website, you can search and the patient can have an idea of what the medication price would be. Most of the time it's not going to vary based on pharmacy, but it might, and so that gives the patient an idea before they go to a pharmacy with a prescription what they're looking at cost-wise. The next resource that we'll talk about is Tennessee CoverRx, and this is a pharmacy assistance program for patients who have no pharmacy coverage. So this is restricted to people, they might have medical coverage, but they can have no pharmacy coverage at all. And it's not health insurance, so that's something important to keep in mind for patients, is it's not going to help with office visits, but they have no monthly premiums associated with this. So it's an added benefit for the patient with no cost associated with coverage. It provides access to over 215 generic medications. It also includes some insulin products and mental health medications as well, which are frequent needs of our underserved patient populations. And then it creates affordable co-payments that vary based on the patient's financial income. And so the patient may have a copayment as little as $3, sometimes it can be up to $10, but still fairly affordable and reasonable for them. This program is managed by ESI, which is Express Scripts, and then it's pretty much covered at all pharmacy locations as well. In order for patients to use this, they must be a U.S. citizen or a qualified alien. So again, someone that has a work visa or a green card and is here legally in the United States. And then additionally, they must be a Tennessee resident for at least 6 months. They must be 19 to 64, and that's because it's trying to restrict access again to patients who do not have prescription coverage. So people who are 18 and under are generally going to be TennCare eligible, and then people who are 65 and older are going to be Medicare eligible. So patients cannot have any type of Medicare, they cannot have private insurance, they cannot have Medicaid, and if they do, then they are not eligible for this. What this program does is it provides assistance for up to 5 medications each month for a patient to provide them a significantly reduced copayment. If the patient has more than 5 medications that they need each month, the CoverRx will provide some level of assistance, but it's not nearly as reduced. Again, the copayments for these medications through CoverRx typically range from $3 to $5, and so that's why it's limited to only 5 medications each month. In order for patients to be eligible, they must be below the federal poverty line, so that is at 100%. That's the true federal poverty line, so patients have to be at that 100% mark or lower, which that differs from some of our drug manufacturer access programs, which take up to 150 to 200% of the federal poverty line. This here provides income guidelines for patients so that they know where that 100% federal poverty level or federal poverty line sits at. And then the next resource that we'll talk about is GoodRx. So this is not an assistance program or sort of an access program. It's mostly a cash price program, again, like our Tennessee drug card. So it's free to consumers and is a website. And then they make their money by advertisements and referrals. So that's how it's offered to no cost to our consumers. And then patients are going to search by drug, dose, and quantity to get the cash price, and it provides the price at area pharmacies as well as discount coupons. And that's something important to keep in mind about GoodRx is most of the time patients need to have the discount coupon in order to get that lower price associated with the medication on GoodRx.com. So here's what the site will initially look like when you go to it. And again, you want to enter the drug name and the drug dose here. And so I initially looked up Spiriva. Off to the left-hand side, you can see that you can switch form. And so for this, if you want the Respimat or the hand inhaler, you also want to select dosage. So we all have different doses per actuation, or for a capsule or tablet, 10, 20, 40 milligram dosages. And then you also want to make sure that you have the appropriate quantity selected. So if the patient needs 1 inhaler, or if they want a 30 or 90-day supply for a tablet medication. And then in the center part of the site, you'll see all of your area pharmacies. You'll see sometimes their estimated cash price. So for example, Kmart, their estimated cash price is $436. And then with the coupon, it drops it down to $323. So if you look at just the $323, it's still significantly expensive, but you have almost $100 in savings that are offered. So this resource is somewhat helpful for our inhalers, but our inhalers are brand medications that are very expensive, and so a lot of times your pharmacies aren't going to offer that good of cost reduction for our inhalers, unfortunately. And then the coupon is shown here. It just provides sort of processing information for the pharmacy technician. And again, patients must have this coupon whenever they go to the pharmacy in order to get that reduced cost. And so there's a multitude of ways that you can provide it to the patient. You can print it out for them, which a lot of them are going to lose. And most of my patients like either the email or the text form so that they can just show the technician their phone whenever they get to the pharmacy. Since the cost reduction or cost benefit is really limited for inhalers, I wanted to show you all what it typically looks like for some of our more affordable generic medications. And so I searched for atorvastatin, looked up the 20 milligram dose for a 1 month supply. And as you can see here, for our tablet medications, a lot of times there's significant cost reduction for patients. So if you look at Kroger Pharmacy, their estimated cash price is $108. Kmart is almost double, so they're at $200. But with the coupon, the cost drops all the way down to $13 for patients, with a lot of benefit with our drug literature for this medication. Wrapping up, the last direct resource that we'll talk about that you'll consider for your assignment are patient assistance programs. And these vary greatly manufacturer to manufacturer. And so we won't talk about the specifics just because it would take a lot of time. And like I mentioned, they vary so much based on the drug manufacturer and what criteria they set. But things you'll want to consider and make sure you look at on the application are U.S. residency. So some programs only provide this to U.S. citizens. Some will provide to U.S. citizens or legal entrants. And then some will provide to U.S. citizens as well as illegal immigrants. They also vary based on financial information for the patient. So the patient has to be at or below 150% of the FPL. Some, it's 200% or below. And then some of the programs, the patient cannot have any type of prescription insurance. Some will allow patients who have Medicaid, but their copayment is too expensive, or maybe patients who have Medicare who are currently in the donut gap. So those are things you want to consider. When patients apply for this, it needs to be sent by their provider. It has to be signed with the person who is authorizing the prescription. And then a lot of clinics that I've been at or that I've worked at, they have the medication sent directly to them because patients a lot of times move frequently or maybe won't take the medication, might not store it properly. So it can be sent to the patient's house a lot of times, but most people will have it sent to the clinic that the patient's receiving it from. Generally, the manufacturer is going to provide a 90-day supply, and then once a patient applies, their application is good for a year. So they have to reapply every year, sometimes every 6 months. And then patients need to call anywhere from 2 to 4 weeks in advance in order to request a refill when it's due to allow for shipping time. Processing is about the same time, so somewhere in 2 to 4 weeks is the time once you submit an application for them to determine if the patient is approved or not. And this is only for brain prescription medications, but it provides the medication at no charge to the patient. There's 2 websites that sort of collect all information and provide it to you, and those are RxAssist and PPIRX. And so they have a master list of all manufacturers and what prescriptions they currently offer patient assistant programs or PAPs for. The first is RxAssist. I just want to briefly orient you to the website. So on the left-hand side, you'll see healthcare professionals, and then you'll want to click on the Learn More button. And then there's 2 ways that you can search. You can either search directly by drug name, or they have a PAP program directory that lists all the current PAPs that are available from drug manufacturers. And so I searched again for Spiriva, and it shows you that the drug manufacturer, Boehringer Ingelheim, has a patient assistance program and provides a link to the online application. Then moving to PPRX, or Partnership for Prescription Assistance, this website is actually really slick and very helpful to patients, and I really enjoy using it. You'll look at the bottom left, and you'll want to click on the Get Prescription Help, and the patient can actually enter the name of the drug, or the provider can enter the name of the drug that they're trying to find information for. And it has 4 steps in gathering information. So the first is for the patient to provide all medications that they currently take. And then the next is gathering information about that patient and trying to determine what their eligibility may or may not be. So they need to provide their age, their zip code, household size, and then monthly income or yearly income. They also need to provide residency status, if they are pregnant, if they are eligible for any type of insurance, so that's Medicare, Medicaid, private insurance as well. And then they also have a natural disaster resource, so they ask if the patient is seeking medication because of a natural disaster. Step 3, they provide results for all the medications that the patient searched for and any potential points of access. And so I searched both in Johnson City, Tennessee, and then in Asheville, where I live as well. In Tennessee, there's Bridges to Access, which that is the manufacturer PAP, or Prescription Assistance Program. TennCare is also an option because I put in low financial income that made me Medicaid eligible. And then CoverRx is also an option for the medication I searched, Flovent. So that again is for patients who have no insurance, and it's operated by ESI. Then in North Carolina, my options were a little bit slimmer. So again, because my eligibility for financial information was so low, I'm eligible for North Carolina Medicaid and then eligible for the PAP program as well. So I selected that I wanted to download information for the PAP, or Bridges to Access. And then they provide tools for me to actually start the application process. So it has options for me to download it. It has options for them to email it to me. And then if you see this orange button down here, Get Applications, it provides that manufacturer PAP to the patient. Wrapping up, I wanted to talk about a few other considerations. So these are not assistance programs for patients, but just things to keep in mind as you move through the curriculum and work on patient cases and again start getting out on your experiences. So $4 drug lists are great resources for patients as well. A lot of our chains offer them. Also, many independents offer them as well. Food City, the patient must enroll at a cost of $10 a year. And then our two big chains, CVS and then Walgreens, don't actually have a $4 drug list, but they do have a discount program. The cost is not ever to the $4 ever, so it's usually around $10 to $30 for some of our generic medications. And then these have an enrollment fee as well, somewhere around $20 to $30. Drug repository programs are also something to consider. There's a few states that have established these. Ohio has a really big program. Maryland and North Dakota, Missouri, and Iowa also have them. And then Tennessee has charitable pharmacy laws and drug repository laws, but I have not actually encountered a drug repository program yet. These must be established by state law, but allow for medications to be donated and then to be dispensed at patients for very low fees, only collecting a dispensing fee to try and provide coverage for staffing medications, pharmacy containers, etc. Pharmacies can accept medications from nursing homes, long-term care pharmacies, and wholesalers. Most states do not allow patient or pharmacies to accept medications from private individuals. So if a patient was on hospice care and then the widow wanted to donate the medication, some states allow for that, but most do not. Controlled substances also cannot be donated. And then most of the time, medications have to have a 6-month expiration date or longer in order to be donated. The next program is the 340B drug program, and this came about in the 1990s as they looked at re-regulating Medicaid laws and drug cost laws for Medicaid. And at that time, they were trying to contain the costs of Medicaid care and rewrote this law, and what ended up happening is they prohibited drug manufacturers from donating medications. So previously, our drug manufacturers would donate medications for free to hospitals that had disproportionate share care. So they had a lot of patients who were uninsured or Medicaid populations. And with this law, if a manufacturer offered a drug at no cost to any hospital, any entity, they have to offer it at that price to everyone. And so 340B programs were created to try and circumvent that law, creating an issue that they initially didn't intend to create. It's a discount program that's available to healthcare providers who serve low-income patients. So a pharmacy or clinic has to meet a certain Medicaid payer mix and uninsured patient payer mix. So they can have privately insured individuals like myself, but they can only be a small proportion, around like 5 or 10%. They then have to have so many Medicaid patients, so many Medicare, and so many uninsured. Only covered entities and qualified individuals are eligible for 340B. So covered entities are going to be a community health center, a disproportionate share hospital, and then a provider who is employed by that covered entity must write the prescription in order for the 340B medication to be used. This must be maintained in a separate inventory. So if a hospital has 340B, or if a pharmacy like Kroger or Walgreens has 340B, they have to maintain that separately from their inventory for patients who are not seen by those covered entity providers. This can be either physical inventory, so it's stored in 2 different areas of the pharmacy, or it can be kept electronically, which is what most pharmacies do. Medications are then steeply discounted to the pharmacy, so the pharmacy is able to buy them at a greatly reduced cost. And then the patients then receive reduced costs based off their financial information, financial bracket, or reduced copayment. Information is listed here from the 340B University. Record keeping is really important, so the covered entity and the pharmacy that provide these 340B medications, it's not a matter of when they're going to get audited, they'll get audited. but when they will get audited. And then the financial benefit for pharmacies exists when the patient either has Medicaid coverage or when the patient is above 200% of the federal poverty line, and that's because they buy that drug for a reduced cost and then make more money off the copayment that they offer to patient populations. So that's all that I have for you all. Hopefully this provided a helpful overview for resources that are available for patients who might have trouble affording prescription medications. And then I just want to highlight Dr. Freshour's worksheet real quick for you. So again, each of you have an inhaler that you are assigned based on your group, and then just a few simple areas in the table to fill out to try and create some comfort and knowledge base of these resources. So she has GoodRx, Needy Meds, and then PPRX. Just that again is going to be an access point for your inhaler manufacturer patient assistance program. So it's going to overlap with this one down here, the inhaler manufacturer. Because again, PPRX is pointing you to that manufacturer's patient assistance program. And then the last one is Tennessee CoverRx. So is there a cost to enroll in the program? Do they have any access fees or premiums for patients? Are people who have Medicare or Medicaid, so TennCare patients, are they eligible? Citizen status. So who do they provide access to? Can it be anyone? Do the people have to be a citizen? Is it maybe citizens and legal immigrants? What is the medication cost or level of discount? So does the patient have reduced copayment? Is it offered at no cost? For GoodRx, what is that coupon amount to? Duration of discount. So is it just one fill? Does it last for 6 months? Does it last for a year? What are the income limitations? So are there any limitations? Does the patient have to be at a certain amount of the federal poverty level? And then the notes and hints are just any additional information that you think is helpful or important to consider for that access program. I'll be in on Friday, so the 13th, to check in with you all and to answer any questions you may have. But feel free to email me in the interim if you have any questions about this assignment. And again, I hope that's a good learning opportunity for y'all.